Chris Kresser said that we have lots of meta-analyses, but one of the best-known meta-analyses published in the journal Obesity Reviews was of 17 randomized controlled trials of low-carb diets that were in high saturated fats, and they found that low-carb diets neither increase nor decrease LDL cholesterol. But what they did find was that low-carb diets were associated with decrease in body weight improvements in several cardiovascular risk factors, including triglycerides, fasting glucose, blood pressure, body mass index, abdominal circumference, plasma insulin, C-reactive protein, as well as an increase in HDL cholesterol. Now, there have been 10 meta-analyses of randomized controlled trials looking at low-carb diets for weight loss. All 10 showed that the low-carb diet either outperformed in most cases or was at the same level as low-fat diets. There have been several meta-analyses that have looked at low-carb diets for diabetes and even cardiovascular risk markers, and all of these meta-analyses have found that low-carb diets are superior for glycemic control, for reducing insulin, for reducing triglycerides, and have beneficial effects across the board without increasing cardiovascular risk markers. What do you think of this statement?
Chris Kresser is way off base. There have been a number of studies that have looked at diets that could be characterized as low carbohydrate diets. If it's low in carbohydrate, it has to be either high in fat, high in protein, or high in both. You have to look at this whole spectrum of biochemical data. Is a high-fat, high-protein diet healthy? In fact, Dr. Walter Longo at the Keck School of Medicine and University of Southern California has said a high-protein, high-fat animal diet is the most dangerous of diets because that is the bulk of the data, whether biochemistry. There are no low-carb, centenarian, long-term communities that you can look at and say, boy, it worked out great for them and we should model ourselves after them. It simply doesn't exist. What he's focusing on is a couple what you call biomarkers. If you eat a low-carb diet very often, you're also dropping the number of calories you're eating in a day, possibly. The quality can vary from very good to very bad in these diets. But biomarkers, blood sugar levels, blood cholesterol levels, what we care about even more is heart disease and survival. And there are, in fact, also 10 meta-analyses, not written by vegan proponents, just by scientists, that diets that are characterized as low carb compared to diets that are of a more mixed variety, like people usually eat, with hopefully complex carbohydrates like beans and peas and lentils and whole grains, are actually associated with excess death rates. At low carb diets, excess death rates, something I've called the low carb high coffin diet. That should cause people to be concerned. It's in the scientific literature. The largest one I know of is in 2010, Dr. Noto, N-O-T-O, and had about 250,000 people in that single study. And there's one from Greece and one from Sweden, from the United States. It's been an international observation that if you characterize people's diet as low carb and follow them, their death rate is high. Concerning, and there's reason to believe that could be accurate because of the excess animal protein, animal fats. So at the present time, I think it's very irresponsible for medical people or health professionals to recommend a long-term low-carb diet that in exchange is jacking up animal fats or animal protein foods like meats and butters and cheeses and dairy. Just to be complete, there is a plant version of the low-carb diet. It is possible to take a plate full of arugula, put some tofu, some walnuts, some lupini beans, cover it with some extra virgin olive oil. The net carb content is very low. The percentage of calories from fat could be 80 or 90%. And there are people who have tried it. I'm one of them for a week or two. A couple other doctors I know. One physician I know does it regularly to help control her type 1 diabetes. She's extremely well schooled and is very carefully watching her arteries and all. It's not an experiment without careful consideration of the downside. But there's really no model for vegan keto, vegan low carb either. It's just it can be done. And really that's an experiment too that I never advise to my heart patients. The only diet shown to halt and reverse cardiovascular disease, number one killer in men and women, also shown to have an impact favorably on prostate cancer in Ornish studies, is a diet that's high in carbohydrates from whole sources, beans, peas, lentils, whole grains, fruits and vegetables, and naturally low in fat. And that's the model we should recommend to people.